Hi everyone, I'm Hannah Harvey, and today I'm going to talk about how motivational interviewing can be used to enhance therapeutic methods, relationships, and treatment outcomes. First, we'll define motivational interviewing, also known as MI for short. We'll clarify what MI is and what it is not, and how it can be effective in facilitating behavior change. We'll also go over one essential component of behavior change known as self-efficacy or self-determination. Then we'll focus on a specific approach for understanding and facilitating behavior change called the trans-theoretical model, or the stages of change model, abbreviated as TTM. It'll also be important here to discuss the realistic possibility of relapse and what can be done about that. And finally, we'll tie together how motivational interviewing can be used to enhance the trans-theoretical model to increase self-efficacy and incite behavior change. So let's dive right in. First, let's just make clear what motivational interviewing is not. Healthcare professionals are naturally in a position of power in the patient-health professional relationship because they are viewed as the experts to whom the patient is coming for help. But MI isn't used to enforce behavior change or to push the client in the quote-unquote right direction. The spirit of MI doesn't have a place for dominance over the client or telling the client what they should be doing. Even though MI is a great way to move a client out of a state of ambivalence, it doesn't explore ambivalence. It doesn't delve into the pros and cons of making behavior changes, and it doesn't involve engaging in sustained talk where the client discusses the reasons why they should not change their behavior. While motivational interviewing might seem like a simple concept, it's really not something that's easily learned overnight. It's a skill that's developed with time and practice and experience, and if used properly, it can be a very effective tool. So what is motivational interviewing then? MI is an approach that can be used to help a client change their desired behavior by utilizing their internal motivation for change and strengthening the client's self-confidence. It requires collaboration between the client and counselor because both the client and the counselor bring their own expertise to the table. The counselor is an expert in their profession and the client is an expert in their own life. And together, the client and the counselor work together to find ways to reach the client's desired goals. An effective MI relies heavily on the counselor's skills at facilitating the intervention. The counselor must be able to listen attentively and respond reflectively and articulately. They must be empathetic and understanding, non-judgmental and genuine, and in the best interests of the relationship with their client, they really should make sure to convey this accepting and respectful attitude early on in order to establish trust. They need to be able to identify and promote the client's positive attitude toward making change, also known as change talk, and be supportive of and encouraging of that. The client is really the one responsible for whether behavior change occurs, and so the counselor is their unwavering coach and cheerleader. The success of motivational interviewing relies heavily on whether the client has improved self-efficacy. Self-efficacy can also be defined as self-determination, self-confidence, or self-belief. Stronger self-efficacy has been positively correlated with increased health behavior change, so it's clearly an essential part of the behavior change process. If a client genuinely believes in their ability to change their behavior, it's more likely they'll be confident when facing obstacles and making decisions and working toward their goals. And in effect, self-efficacy will become enhanced as the client starts to accumulate success. The counselor can help to promote self-efficacy by staying optimistic and emphasizing the client's strengths and telling them about how others have succeeded in making behavior change. As goals are met and barriers overcome, an individual's self-confidence naturally goes up. Accomplishment is a good feeling, and it can lead a person to believe they're capable of reaching their goals and beyond. So this is woven into the essence of the trans-theoretical model. The trans-theoretical model, or TTM, can be thought of as a progression of readiness to change. It's a helpful technique for professionals to gauge where their patients are in relation to making behavior change. We can think of each stage of change like a rung on a stepladder. According to the TTM, there are 5 stages of change, which are pre-contemplation, contemplation, preparation, action, and maintenance. A person who has serious doubts about the benefits of making behavior change, who's not ready to change, who maybe feels hopeless about changing behavior, this person's in the pre-contemplation stage, according to the TTM. For someone in this stage, the pros and cons of making a behavior change are not balanced. So an effective intervention to help move them in the direction of change will focus heavily on the benefits of making the change. It's important for counselors working with clients in this stage to provide the client with information to raise awareness, but also to be sensitive to the emotional difficulty that might come with being faced with making a behavior change. Hopefully over time, the client will begin to see that the cons do not outweigh the pros, and then they will be moving from pre-contemplation to contemplation. And a person who's moved into the contemplation stage is experiencing ambivalence now about making a change. So in their mind, the pros and cons for making change are balanced. Some people can remain in this stage for a long time, even years, just waiting for the aha moment when making a change will feel right to them. People in this stage are aware of the problem, are considering changing their behavior maybe within the next 6 months, but barriers to making change are still viewed as difficult to overcome. And this is why it's crucial for the counselor to help boost the client's self-confidence in this stage. Positive feedback can really go a long way, and so can receiving support from family, friends, and the community. This stage is really an important turning point for becoming ready to make change. And a person who's really getting ready for change is in the preparation stage. Maybe they've already made a few small steps toward change, or maybe they intend to change within the next month or so. A person in this stage believes the pros outweigh the cons, so they're no longer ambivalent. They're becoming more and more committed to the idea and process of making change, and they're open to making a game plan. The counselor should do all they can to encourage the positive changes the client has made or intends to make, and should help the client set realistic goals while also minimizing cues that could lead to relapse. This will get the client to a point of being able to take the leap and make bigger changes. The action stage is where big behavior changes start to occur, and here we're seeing the client work at changing their desired behavior for up to 6 months. While it may be encouraging to see a client in this stage, the counselor really should be aware that it's common for relapse to occur within the first 3 to 6 months of the action stage, because even if the client has been working on their behavior, these changes aren't yet permanent. So it's important for the counselor to be able to adapt the client's intervention to account for this possibility, remaining supportive, realistic, and optimistic about the future. And ideally, the client will eventually move into the maintenance stage. New behaviors in this stage have been maintained for more than 6 months. A person in this stage has been actively working to keep their new behavior alive and continues to adapt to prevent relapse. And here the counselor actively collaborates with the client to solve or prepare for problems that may come up. They can help to make adjustments as necessary and work on encouraging the client to seek supportive social circles and environments that will best set the client up for success in maintaining their new behavior. But it's important to note too that just because a person is in the maintenance stage, it doesn't mean that relapse isn't a possibility. Lapses in progress are an expected part of the behavior change process according to the TTM, and this can happen in any stage. It's not uncommon for people to slip back a stage or two, and it's supposed that this could be partly due to a shift in the balance of the client's perceived pros and cons about changing a behavior. So it's especially important for counselors and health professionals to work through these relapses with the client without judgment, without blame or negative feelings. And bottom line, perfection is just not possible, so everyone's challenges are different. Knowing this, the counselor can tailor the intervention to the individual, and especially where a client may be working to change a few different behaviors, it's possible that they may be in different stages of change for each behavior, so the counselor will likely have to adapt the intervention to account for this. Recurring lapses can happen, but in order to continue working toward progress, it's really important for the client and counselor to remain realistic and optimistic and to not get discouraged. Especially where a client might be having difficulty becoming ready to make a change like we see in the contemplation stage, motivational interviewing can be a huge help. While it can be useful for a counselor to use the TTM to distinguish the stage of change the client may be in, the use of MI can be helpful in allowing the client to effectively move toward higher stages of change while also increasing self-efficacy in the process. MI is notably most effective in resolving ambivalence, so it's best used with clients who are in the contemplation stage. Keep in mind that any one client might be in different stages of change regarding various behaviors, so MI can be woven into the intervention as needed, and this flexibility is part of what makes MI such a useful tool. And of course, a huge benefit of MI is making the client feel confident in their independence while simultaneously making them feel supported. And ideally, this will lead to behavior change that sticks. Thank you.